Okay. Hi, hello everyone.
Hi.
So glad to have all of you here today. Welcome to the IFLA Public Libraries midterm webinar with the theme of places that care for people, public libraries delivering health and well-being outcomes. I am Ranita Rajaratnam, Director of Programs and Services from the National Library Board in Singapore. I'm also a member of the IFLA Public Library section, and I'm the facilitator for today's webinar. With me, helping to manage this Zoom session is Kate Ferguson, Regional Partnerships and Programs Manager at the Yarra Plenty Regional Library in Australia. I would like everyone to please note that today's session is being recorded, and this presentation will be uploaded on IFLA's YouTube channel. We are very pleased to have with us today library professionals and advocates from Australia, Japan, New Zealand, and Malaysia to share their meaningful initiatives with us. There are 4 presentations, and each will be about 20 minutes. There'll be an alert at the 15-minute mark to wrap up the presentation. Participants who have joined us, as you hear from each speaker, please enter your questions in the Q&A text box that you would see at the bottom of your screen. And we will share your questions once all the 4 presenters have shared their initiatives with us. Everyone, please join me in welcoming the speakers for our very first presentation. We have Jenny Musty, the Library Services Manager at Campus Library, and Deborah Rosenfeld, Head of Library Sector Engagement at the State Library of Victoria. They will be presenting on how library services across Victoria in Australia have worked together to create the new Libraries for Health and Wellbeing framework. Over to you, Jenny and Deborah.
Thank you very much. It's wonderful to be here. And Deborah's just popping our presentation onto the screen. Won't be a sec. But thank you very much for the opportunity, and hello to everybody that's joined us today from wherever you may be situated. So thank you. Deborah Rosenfeld and I are thrilled to be given the opportunity to share this landmark strategic work and action plan with you today, as we consider that libraries do indeed play a role in caring for people. Libraries have so much potential in delivering health and wellbeing projects and outcomes for our communities. Next slide, thanks, Deborah. So this is Deborah and myself. I'm a library manager of a small rural library service in Victoria, and Deborah is the head of the library sector engagement at the State Library of Victoria. I will now hand over to Deborah to introduce our topic.
Thanks, Jenny, and hello everyone. It's really terrific to be here. So I'm going to start off by giving you a little bit of background about the genesis to the Libraries for Health and Wellbeing program. And we call it a program because it's much bigger than just the development of the strategic framework. So State Library Victoria and Victoria's 50 public library services have a decades-long history of working together to deliver improved library services to all people in our state of Victoria. Every 3 years, we make a joint commitment to a program of strategic statewide initiatives for the development of Victoria's public libraries. And this program is determined at a planning summit attended by all public library managers and the leadership of the State Library. Now, going back in time to 2019, when we were heading towards a planning summit, there was a lot of consideration given to the key trends that were influencing and challenging public libraries at that time. Things like keeping up with technology developments, dealing with funding setbacks and increasing customer demands, the growing distrust of authority, and very many health-related issues. These ranged from the loneliness epidemic and the growing number of people experiencing mental health issues to the rise in chronic disease. So really it came as no surprise to us that at the planning summit in 2019, nearly one-third of the proposals put forward for strategic development initiatives between 2020 and 2023 related to community health and wellbeing. There was overwhelming support for a 3-year program to build understanding of, clearly articulate, and enhance the role of Victoria's public libraries in this area. And 4 areas of work were identified, and you can see them there on the screen on the left. Developing a strategic framework for the sector and an action plan. A community engagement program focused on innovation in service delivery, a research program, and a program to upskill library staff. So the rest of this presentation provides you with an overview of each of these areas. Jenny, over to you.
Thanks, Deborah. So before we go any further, why libraries? Well, this project certainly gained inspiration from evidence-based research from the US and the UK that libraries can play an important role in supporting people's health and well-being. Looking more locally, we know in Victoria that there are about 270 library branches as part of the Public Libraries Victoria network. A network that works collaboratively and cooperatively to deliver positive outcomes. We recognise that libraries are indeed already delivering many activities and programs that support health and wellbeing, and they are perfect places to do so. We have enthusiastic staff who love building relationships with their community. We are accessible and trusted as safe places and also trusted places for providing information. These strengths mean that we can have even a greater positive impact when we form new partnerships and support the work of our local, state and federal key health agencies and organisations. Next slide, thanks. So I'm just going to introduce the first part, which is the key deliverable 1 of the program. The Libraries for Health and Wellbeing statewide project will be conducted over 3 years, perhaps with the potential to be expanded over the next triennium. As Deborah mentioned, there are 4 key deliverables, the first one being a major piece of work which was developing the Libraries for Health and Wellbeing strategic framework and the action roadmap, which essentially underpins and launches us into the other 3. Developing the framework was a large consultative piece of work, ending up with over 1,200 pieces of data that contribute to a very robust framework, which was facilitated by our consultants' Spark strategy. It involved library staff and community members right across the state, as well as local and international voices providing input through interviews and workshops. The work group participated in a number of workshop and stress testing exercises to ensure the framework made sense. It was practical and could be used as a working document for all libraries across Victoria. Over to Deborah.
I'm going to talk now about the actual framework. The Libraries for Health and Wellbeing strategic framework is available on the State Library Victoria website, and I do encourage you to take a look at it. Today, I've just got a couple of minutes to give you a really high-level overview, and there's a lot in it, and I've really been appreciating it over the last few days in preparing this presentation. There's a lot in it that I can't possibly convey to you in this presentation. So there's no doubt that the Libraries for Health and Wellbeing strategic framework has been an extraordinarily important document for uniting Victoria's public libraries. It's enabled them to talk with confidence and authority about the vital role that they play in supporting community health and wellbeing. And it has provided direction for service development across the state. The framework identifies the key roles of public libraries in the health and wellbeing space as giving support to primary health and wellbeing service providers, building the skills of community members and providing them with the spaces, resources and programs needed to look after their health and wellbeing, linking people with each other, library staff and other health, wellbeing and community services, and sharing the health and wellbeing experiences and needs of community. The framework identifies 3 areas where public libraries have the greatest impact on community health and wellbeing and should focus their service delivery. And you can see these in the Venn diagram on the screen. Our key impact areas are around social connection. By that, we mean supporting people to foster meaningful relationships with each other and develop a sense of belonging in their lives. Mental health, that is empowering people to cope with life's ups and downs and access the supports and services they need to improve their psychological state. And physical health, helping people to understand and manage their physical health, prevent disease, and improve their physical outcomes. The framework, have I gone backwards? I think I've gone the wrong way here. There we go. The framework speaks of the priority that public libraries give to ensuring that their communities feel empowered, supported and connected. And it speaks to the priority that public libraries give to working with others to effectively deliver health and wellbeing services, to ensuring that their staff are equipped to effectively assist community members with their health and wellbeing, ensuring that the community, government, service providers and funders understand that public libraries are an integral mechanism for the delivery of health and wellbeing solutions to the community, and to ensuring that libraries have access to the required evidence, tools and resources to support the health and wellbeing of the communities that they serve. The framework shows how the work of public libraries is aligned to the UN Sustainable Development Goals, and importantly, the framework contains an action roadmap, a commitment to 5 key strategic statewide initiatives and to 6 initiatives that every library service will undertake independently over the next 2 years to ensure that Victoria's public library services continue to grow in the health and wellbeing space. Now, one of the statewide initiatives is a community engagement program that encourages participating libraries to be innovative and work in partnership with others when developing health and wellbeing programs. And Jenny's going to talk to you about this initiative.
Thanks, Deborah. So as she said, the second key deliverable of this program is to provide health and wellbeing innovation grants to get libraries really excited about this whole space of health and wellbeing. So far, 2 rounds of funding have been offered to libraries across the state, and it is really exciting to see the range and variety of projects that library services and their local partners can and will undertake. The focus is on making the projects community-centred partnerships and to highlight why libraries can be identified as key leaders in the health and wellbeing space. An excellent mix of rural and metropolitan libraries received funding in the first round. The topics are diverse, from information-based to activity-based, focusing on identified target groups, either children, families, young people, or older adults. One of those projects on the screen that highlights to me is the health program at our Indigo Library about No More Dr. Google, focusing on men's health. And it's also wonderful to see libraries working together as well as incorporating partners to deliver programs. More of the second round of funding has initiated some other different types of projects. And at first glance, you can see common themes, including mental health and wellbeing, resilience, connection, creativity, environmental sustainability, and supporting vulnerable communities. Overall, they are very innovative, unique approaches to deliver health and wellbeing outcomes within their own local areas. However, a key aspect of the projects is also how well they can be replicated to other library services. But the underpinning aim is to inspire and encourage lots of ideas and how to best work with our local partners to deliver positive outcomes. It's really about seeing what is possible and moving beyond the core components of service delivery to perhaps the stretch components of our framework. And I'm really looking forward to seeing some of these projects be delivered. Thanks, Deborah.
The innovation program has delivered some great benefits to individual libraries and to different communities around the state. It's also delivered an unexpected and quite delightful outcome for us. Now, there's an organisation in Victoria called Vic Health, which is a major state government funded health promotion agency. And we asked a representative of Vic Health to join the selection panel for the innovation program. They were surprised and really thrilled to discover the wide range of health and wellbeing programs that public libraries were proposing to deliver. They had no idea about the breadth of the work that we do in public libraries. And they wanted to encourage us to do more of this work and proposed a partnership that we hope to see develop over many years. So with fundings and other support from Vic Health, 4 Victorian public library services are embarking upon programs with groups of vulnerable young people in their communities to co-design and deliver library services that will make a significant positive difference to the mental well-being of this group. Eventually, we would like to see every Victorian public library service participating in this initiative because it would transform the way libraries engage with young people across the state. So a great new partnership with Vic Health, $200,000 in the first year. We're just really thrilled.
5 minutes left.
Thank you. The third key deliverable for the program is the research component of it. And the timing of this part of the project also coincided with the delivery of the Advocacy Statewide Development Project, which is also a statewide public library survey. It made sense to include questions within the survey about how libraries support health and wellbeing. And this valuable data will feed into the research component of the library's health and wellbeing project. And over the last week or so, we've been conducting workshops with a number of representatives from health and wellbeing organisations to discuss the framework and the potential for further partnerships and opportunities. The State Library of Victoria and Public Libraries Victoria also ensure that leadership programs and learning opportunities are provided, including the Shared Leadership Program and scholarships. Over the years, many of the shared leadership learning projects have focused on health-related topics, and over the last 2 years, the scholarships have focused on homelessness and the latest one on social prescribing. The Libraries for Health and Wellbeing framework will proudly join previous landmark research initiatives and will have its own place in terms of placing a value on the health and wellbeing benefits generated by public libraries. Thanks, Deborah.
And our 4th deliverable. So this is after the strategic framework, building the evidence base through research and community engagement programs. Our 4th deliverable is all about the staff in public libraries. It's all about upskilling public library staff in the health and wellbeing space of their work. And it happens in all sorts of ways. Seminars, workshops and conferences are being run to build knowledge and skills. Opportunities are provided for public library staffs to meet with and discuss cooperative approaches with representatives from many health services. The Community Engagement Innovation Program encourages public library staff to take risks, to push outside their comfort zones, to deliver new types of programs, and to learn from the experience. Leadership programs encourage participants to explore best practice in development and delivery of health and wellbeing services, such as social prescribing and services to support homeless people. Every public library in the state is being encouraged and supported to incorporate a health and wellbeing focus into their strategic and operational planning. Big emphasis on staff skill development. Jenny.
Thank you. And just in closing, we just remind that in developing the framework that we recognise that it provides flexibility for local libraries to meet the health and wellbeing needs of our communities. And it also provides local libraries as a framework for them to support the Sustainable Development Goals, which are listed there on the screen. So thank you very much for listening to our presentation today, and we look forward to hearing your questions later in the seminar. Thank you.
Thank you so
Thank
very
you,
much.
everyone.
Thank you, Jenny, thank you, Deborah. Next up, we have Mayuka Saiki, Chief Librarian from a children's section at Totori Prefectural Library in Japan, and she will share with us the Totori Prefectural Library programs focused on health and welfare and how they have made a healthier and happier environment for their community. Over to you, Mayuka.
Yes. Hello, my name is Mayuka Saiki. I work at the Totori Prefectural Library in Japan. Now, I'm going to share my slide. Today, I would like to talk about how our library is supporting people with dementia and disabilities and making our community a healthier and happier place for everyone. Before getting into the main subject, let me briefly introduce Totori. Totori Prefecture is located in the western part of Honshu. Totori has the most famous sand dunes in Japan. Many Japanese people think of the sand dunes when they hear Totori. Totori Prefecture's population is around 550,000. It's the least populated among the 47 prefectures in Japan. Totori Prefecture has 4 cities, 14 towns, and 1 village in its territory. In the Japanese local government system, our prefecture is the regional authority comprising municipalities and oversees the broader regional administration. Those municipalities have 30 neighborhood libraries in total. The Totori Prefectural Library provides direct services to its users, but it also supports those local libraries. The Totori Prefectural Library has a mission to be a library that is valuable to the citizens of Totori and contributes to the community as a whole. One way to accomplish this mission to be a reliable source of information for their professional and personal lives. As part of this effort, we have discussed how we might be able to provide support for people's health as a library. And as a result, launched programs in health and welfare in collaboration with other institutions. We launched Community Health Information Services in 2006. Since our knowledge in the field is limited, the library created a special committee for the services. This advisory committee consists of members from 2 patient associations, the Totori Medical Association, the Totori Nursing Association, the Library of the Totori University, which has a School of Medicine, the Totori Prefecture Medical Policy Division, and many others. We built a network with the committee members. They provide their expertise on how to develop our collection and services. This is the Community Health Information Corner. With the help of the committee, we are expanding and developing our medical and health collection. Books, databases, and information provided by patient groups are all available here. This is the Living with Illness Corner. Here, people can find stories of patients and families living with illness. These books are classified by disease name so that people can find the books easily. Most books of this type are essays and memoirs, so it is difficult to tell which disease a book treats as its main subject just by its title. Therefore, we make sure to enter the name of the disease that the book is about in the database, and that it belongs in the Living with Illness section. Book lists are placed in the same section at the entrance of the library so that people can pick them up easily. The lists are also available on our website. Now, I would like to talk about our programs for people with dementia. The senior population ratio is very high in Japan. 1 in 3.5 people in Japan is 65 years old or above. In Totori, the ratio is 1 in 3 people. Japan is one of the most aging societies in the world. According to a research done in 2018, 1 in 7 elderly persons in Japan suffers from dementia. The Japanese Health Ministry estimates that this number will become 1 in 5 people by 2025. Dementia is a common disease that can affect anyone. As part of our effort to create an inclusive environment, we have been providing services and programs for people with dementia. We have been hosting lectures and workshops, training staff, and organizing Orange Cafe with dementia patients and families. In one lecture, people had the chance to listen to a patient's story. Ms. Fujita suffers from early dementia and authored a book titled, "It's Okay to Get Dementia." In the lecture, she and her doctor introduced her case to an audience of 200 people. This is part of our efforts to help everyone understand what it's like to live with dementia and support people who actually do. And we believe the voices of patients provides strong mental support for other patients with the same disease. In one of the workshops we organized, librarians, dementia patients, family members, and healthcare professionals got together and discussed how we should build a dementia-friendly community. People discussed many ideas as to how we might help people with dementia continue to use the library, such as reducing the number of books that can be checked out at a time, so they have better control over the items checked out. Rental bags in bright colors, so they have an easier time finding them, and setting up a slow counter, so they can take time when checking out books. In 2012, we started a service called Stimulate Your Brain, Let's Read Aloud Together. It is a class for elderly people that aims to help prevent dementia by reading aloud. The library selects materials for the classes. Old songs, poems, folktales, and children's stories are a few examples. Participants enjoy the class very much. In fact, the class became very popular. Now, they are also held in community centers, hospitals, nursing homes, and even at patients' homes. They can check out material for the class from their nearby libraries and also receive assistance from librarians. In 2020, COVID-19 disrupted many of the activities at the library. This program was no exception. But we soon started hearing from many patrons asking us, when will you start the program again? Also, a professor on dementia asked us if the library could do something for dementia patients. So we decided to broadcast Stimulate Your Brain, Let's Read Aloud Together on TV and YouTube in 2020. We developed this program with the local cable TV station. The works we use are Japanese classics and poetry. The text is projected in large letters for legibility, and the text color changed so that elderly people can follow where they are reading. The patrons were very happy, and we received many thank you from them. Next, I would like to talk about programs for people with disabilities. Tottori Prefecture formulated a plan for improving the reading environment for the visually impaired in 2021. It was the first to do so of any Japanese local governments. We have set up the dedicated area for people with disabilities. It's something like the Apple shelf. There are easy to read materials such as books with pictograms, Daisy, and Multimedia Daisy. We also have large print books, picture books in Braille, materials on sign language, and barrier-free DVDs. A magnifying device and wheelchair seats are also available nearby. We also collect audio materials. In Japan, the Library for the Blind and the National Library provide databases of Braille books and audio materials. We use these online databases to search and download audio materials. We download the materials at users' request, and users can check the materials out in their preferred format, a mobile player, SD card, or CD. We collect multiple copies of all the large print books. We ship them to the local libraries. We have been hosting story time with sign language as one of the services for the hearing impaired. The librarian reads a picture book aloud, and the interpreter translates it into sign language. The program has two goals: to make sure all attendees have a good time and to raise awareness of sign language. There is also time to learn simple sign languages during the event. We have been organizing sign language classes for staff since 2006. The instructors are well-experienced professionals. Also, once a week, staff members take turns during morning meetings and teach us a simple phrase in sign language. We created a library introduction video with sign language and subtitles. We introduced many programs with the library mascot whose name is Honji. You can watch the video on YouTube. This is me a few years ago. We keep asking ourselves, what are our responsibilities? What can the library do? We believe that our efforts will lead to making our community a healthier and happier place for everyone. The Rotorua Prefectural Library provides many wonderful programs. We are very proud to have received the Japanese Library of the Year twice. Please let us know your feedback at this address. Rotorua isn't just about sand dunes. Our prefecture has beautiful landscapes, amazing food, and places you can go to for exciting activities. I hope you will visit Rotorua and our library in the near future. Thank you.
Thank you. Thank you very, very much, Mayuka. Before I invite the next speaker, just a reminder to everyone to please enter any questions that you may have in the Q&A text box at the bottom of your screen. Okay, so next we have Laura Marshall, who is the director at Te Aka Mori in New Zealand, to share with us the Interconnecting Vine, which is a collaboration between the Rotorua Library and Lakes DHB Children's Health Hub. Over to you, Laura.
Thank you very much. My connection is a little bit unstable, so if there's any problems, please let me know and I'll try and move to another location. I'll just share my screen. So are we all good with the screen sharing?
Yep, I see it,
Great,
Laura.
thank you. So I'm the director of Te Aka Mori, which is the Rotorua Library, and we are a small city in New Zealand. We have about 70,000 people, but we also have one of the highest deprivation index ratings as well. And as you know about high deprivation index ratings, they do affect people's health and their well-being, which makes projects like this so important. So we're a little library, but we feel we make a big difference with the community. So the beginnings were the DHB, which actually refers to the District Health Board, which is our local health service. We're looking for a place to put their children's health services. Previously, the health services had been part of our main hospital and it really wasn't working for them. It wasn't a family-friendly space. They weren't getting a lot of people turning up for their early childhood checks. So they were looking to try something new. Our library at the time was very old and needed earthquake strengthening. So therefore we got together and had a collaboration between the council and the DHB, or the District Health Board. And this was actually in New Zealand first. So we didn't know what was going to happen and how it would work. So obviously there was a very passionate team that got together and they came up with a health framework. And this framework would guide the strategic delivery and also the direction of the project. And obviously there were some shared goals as well. And the main one obviously was breaking down those barriers to service for both our services. So from that strategic framework, we came up with some strategies that we both agreed on, obviously empowerment, highest attainable health, resilient strength, equity, very important to us, transfer of knowledge, navigating a path to wellness, connecting, and that really meant connecting the community. So creating that place that reflects and embraces our community. And also trust. We wanted to have a trusted health service, but also, as you know, libraries are a trusted source of knowledge. So looking at that, it seemed like a really good connection. And I'd just like to take you through a little bit of the journey of developing the building, because that influenced some of the outcomes. So Te Aka means the vine or interconnection in Te Reo Māori, and Māori is the life force or essence, and the name was gifted to us. So the land that Te Aka Mori sits on was actually gifted by Ngāti Whakaue, who are the local iwi or Māori tribe. And a lot of the design elements came from their marae or their meeting houses and the history of Te Arawa, which are the bigger iwi or tribe for this area. And we set up an iwi reference group to provide guidance on that. And they came up with three sort of overarching sort of strategies that they really wanted us to embrace. This was our EWI reference group. So obviously it was enlightenment, discovery, and collaborative stream. So I just wanted to run you through a little bit of the design of the building because I think it's quite significant in how it works. So the maho is actually the entrance porch, and normally a traditional marae or meeting house will have this at the front of it. So this is our entrance as well. And it has 8 pillars, and these represent what's called the 8 beating hearts of Te Arawa. But that's actually the 8 main descendants of the first chief of Te Arawa. So they have real significance, and all parts of the building do have a significance or a story. And right in the centre of our building, we have what is called a po. Now, in a meeting house or a wharenui, this is the centre post. And in Te Aka Māori, this was also our centre post. And it also stood for the collaborative strength that can be found here. And each floor, that we have 4 different levels, all had a health focus. Now, I don't have time to run you through all of the 4 levels because I'd really like to talk about the collaboration. However, I just wanted to share this one slide. Each floor had a health focus. It had a local Māori focus. The pattern was gifted to us by a local marae. So there was really a lot of thought went into the design. And the point of the design was to try and make the local community, which is made up of 40% Māori, feel welcomed and feel connected and want to come in and utilise this building. Now, interestingly, what we found is there was a really significant change in our demographics. You can see our census, and then you can see library card usage, which was our old building usage, and then you can see the usage of Te Aka Māori. And you can see that Te Aka Māori really now matches the census data, showing that all those design elements and all that work that was put in and all that connecting with the local community actually got the local community into the building. It created a feeling of tūranga waiwai, which to us is the feeling where my feet are, where my place is in this world. We became a meeting place of choice, moving from just a library into somewhere where people would come and hang out and have a cup of coffee and meet their friends. And 2 years later, I'm pleased to say that the Te Aka Māori statistics still match our census statistics. So the community are really embracing us as their place of choice. So if someone is going into this type of collaboration, those design elements and working with the community were just so important to us. So I just thought I'd share a little bit about what we do, and part of this came out of that sort of collaboration and strategic sort of overview. So obviously we're really child focused. We also have a lot of digital literacy, which links in with our health literacy, helping people to understand. We have a lot of adult learning, and obviously with our strong connection with our local heritage. We also have what we call mātauranga services. Now this is services that incorporate a Māori worldview. So we didn't just incorporate Māori into the design element, we also consider it extremely important now, and we have services that, depending on your worldview, we can hopefully help you. Equity programs were very big to us, and community-led programs. In one of the photos there, you'll see our Multicultural Society, and they actually host lunches within the library, and we get up to 150 participants at each lunch. And of course, community outreach and Library to You. We only have one district library, so our outreach programs are obviously very important. And this is just a brief overview of what the Children's Health Hub does within the building. So they have a lot of services, before school checks, vision and hearing, infant and child mental health, newborns, outreach, pediatrics. So they run a big service within the space that we share. So I just wanted to share a little bit about what does that collaboration look like. So one of the simplest ones was our preschool programs. So they are situated, you'll see the photo on the right, that's the entrance to the DHB, and it's in the middle of the children's section. So they obviously encourage their clients to take part in our preschool programs, which is a fantastic help to obviously preschoolers, as you know, those literacy goals. And what we found too is that many of the children that now take part in those preschool programs wouldn't have been brought to a program if there had to be another excursion. So not only did they encourage clients to take part, we then changed the timing of our programs to match when they had most people in at their clinics. And like I said, they would bring the parents out and say, hey, just join in the program. And it's very comfortable just to slip into the program, sit down and join in and really do some good work with your children. So it was one of those really simple things that just made sense. Probably the next one, obviously with a collaboration like this, is events and talks. We started to use each other's space. The photo at the top was one we called the Great Latch On, in which they had a breastfeeding. I think it was one of the biggest breastfeeding events in New Zealand within the library. And also we have family fun days where we go into the community to share our services. Of course, the library always goes, and then we started to invite our Health Hub partners. So the community is getting a double benefit. What we found worked really well too is the library would take crafts and fun and entertain the children, and then the parents would have time to discuss really more important things they don't want their children to be involved in, but the children are still there enjoying themselves. So again, simple stuff, but it just makes so much sense. And information and action. This is another really interesting one. So you'll see there that their entrance is just to the left of the library. And what we found is, working with our colleagues, we developed some new collections. We've developed a nurturing children's collection. It sits right outside their door, and you'll often see the Health Hub nurses bringing out clients, showing them the collection, making suggestions to them. I don't know when you'd ever think a nurse or a paediatrician would be doing that, but they said they're on the spot, being able to take people there, put the resource in their hand. Again, they leave with it straight away. And if the person doesn't have a library card or needs extra help, our staff will go over and help. So it's that really on the spot, in your hand, was just fantastic to see. And again, they admitted if there was another excursion, people would not then be picking up the resources. And of course, for us, we got to introduce some amazing developmental goals. So we'd go and speak to our colleagues, and we've introduced them to our multi-sensory room, which they, although we manage it, the Health Hub does book it for clients, and we also do get community and school groups coming in to utilise it. But you'll see on the right, the bubble tube, we've got the benefits, things to try, and all through that room now is some fantastic developmental goals. We have a wonderful toy library, and as part of the collaboration, we started to put developmental milestones into those toys as well, really thinking about what they're for, and if parents need some help, this is the toy that you should be using. And again, our colleagues do come out and point their clients at these resources as well. And one of my favourite collaborations, so this is what we call our Big Busy Box. And originally it was a collaboration with, we wanted to introduce non-traditional users to our service. It's one of the projects that we're really committed to, and it has an equity focus. People that are non-traditional users tend to be in high deprivation. They also tend to not use health services either. What we wanted to show was that Te Aka Māori was friendly, it was family, it was safe, and we wanted to encourage visitation. The more visits we get, the more people that not only will visit the library, they'll also visit the DHB. So again, we worked with the Health Hub and developed some developmental milestones into the boxes. So not only were they fun, children were accidentally learning some things as well. And originally they were going to be distributed by our District Health Board nursing team, and we also have, as part of council, an equity team. And they were going to go to people in emergency housing. Now, I'm not sure if you're aware of this, in New Zealand we lack social housing at the moment, and we have, I think, about 300 families currently living in motels because we don't have enough social housing within the city. So it's called emergency housing, and they're there short term, but it's not a fun place to be. So what we wanted to do was reach out and say, hey, are you aware just down the road there's a library, there's a health hub, really friendly people, were really cool. So they helped us deliver those. But the interesting thing was they then were used as COVID support. So we started getting contacted by community groups that had members in isolation. Again, the nurses were knowing families in isolation, and these were given out to the children to help with some of the entertainment. They were also delivered in conjunction, like I said, with a lot of our community health providers as well. So it went from being a project to introduce people to library and health services to then help people in COVID isolation. So far over the last year, 824 have been distributed. But a good part about the program is we managed to secure funding and grant money, so it was all at no cost to our local ratepayers. And a couple of the accidental collaborations, which always make me smile. On the left, you'll see our wonderful community group called the Wacky Warmers. So they're a knitting club that get together every week. And once they were always in the library before the collaboration. And after the collaboration, they started to knit baby clothes, and they would give the baby clothes to the health hub, and the nurses and the paediatricians would distribute these to families in need, and that still goes on today. So I think it's just such a fantastic collaboration. And the other accidental one is we have fantastic little craft packs, which I'm sure most libraries have, and during COVID, we really ramped these up so people could take them away and do them at home. And our before school checks team love them, and they give them out to children that have to come in, and same with our immunisation team. Rather than giving children sweets or a treat like that, they now give them a little craft pack, and it comes not just with instructions, but the paper, all the bits and bobs that you actually need to produce this. And this is just a picture of some of the children that sent us their photos, but yeah, they love them. And to date, we've given out literally thousands of those. So early learnings.
Sorry, 5 minutes left.
Early learnings. So when I started here, there was very formal meetings and they didn't work. Nurses and doctors are just so busy that they know what they either don't turn up, they can't turn up, or they're just crazy. However, shared tea rooms and open plan workspace did. Just on the left there, I'm standing in our part of their building, looking into the DHB or the health hub section, and we have a shared tea room as well. We just share all the facilities. So if anyone's looking at a project like this, I'd say go informal, go peer-to-peer, and as one of my staff said, avoid the managers. Learn each other's businesses and invite. We just used to wander down, chat to people, what section are they in, what are they doing, learn a bit about them, and then invite them to be involved. And it won't always work, but try and have fun. And the bottom photo there is us doing our combined waiata or singing practice. For our Māori language week, we do singing. And we ended up in the national newspaper together. So that's us practicing our waiata. So benefits and outcomes. So one of the amazing benefits or outcomes for the DHB Health Hub was there was a huge decrease in the did not attends. So previously, did not attends were running at, say, 80%, and that dropped significantly. Best waiting room ever. Visits were seen as a fun excursion. And our preschool programs increased by 61%. So you can see the children that were coming out were visiting the programs. We included the developmental goals. There was also a really anonymous entrance in another part of the building, which I haven't shown you, for our mental health services for teens. They could come in, sit, go into the appointments, and nobody would know what they were doing. Welcoming safe space and an increased reach into those disadvantaged communities. And obviously, as I already mentioned, there's immediate on-hand resources were available. And the library's busy, increased visibility for those health services. We were also the facilities support, which was very nice for the DHB because we take care of all the maintenance problems. Information sharing amongst staff, and obviously the combined talks, and also understanding community need from a different perspective. The DHB nurses were going into some of the homes that we didn't know about, would make suggestions and vice versa. But also I really liked the staff awareness and the increased appetite for collaboration. Once my staff started collaborating with the DHB, we understood what we could do. And just briefly, a couple of the other sort of our next steps. So we're also doing a lot of work in the dementia and cognitive impairment field. We have a collection, we're doing digital inclusion for those with dementia, and we're also looking at some cognitive impairment therapy toys as well. So from the DHB or the Health Hub collaboration, we're now starting to work with Lakes Dementia. And we also now have a lot of drop-in partnership services. We work with the melanoma, diabetes, hospice. We have a telehealth service that we're looking at starting as well. And just in summing up, again, why us? So as you all know, our services do incorporate that health literacy, digital literacy, trusted information and resource. These elements we felt interconnected with all the services we partner with. We're family friendly, we're one of the few safe and welcoming spaces. And what better way to support community wellbeing than through our combination of knowledge and the DHB Health Hub's practical support. Thank you, everyone.
Thank you very much, Laura. Our final speaker for today is Datin Paduka Mastura Haji Muhammad. She is the director of the Selangor Public Library Corporation in Malaysia. She will be sharing with us the Raja Tun Uda Library's experience in helping their community during a flood crisis in December last year. Over to you, Datin Paduka.
Okay, thank you very much, Renita, for the introduction. And today, Juliana, one of our librarians, will help me in share the screen. And also, I would like to say thank you to Kate Ferguson from Australia, who are managing this Zoom platform. And also to all the viewers and also the panelists who did give a very good presentation, and I learned a lot from this. Thank you very much. For a start, say Assalamualaikum and good afternoon from Selangor, Malaysia. And actually, I'm in Ipoh now, Ipoh Perak. Okay, so first, I'm very thankful for the opportunity to share our experience at Raja Tun Uda Library, Shah Alam, and we hope that we can learn something together from this experience. And I would like also to give a special thank you to my good friend, Dato' Dr. Rashida, who introduced me for this session. Thank you. Okay, Nana, we can start the presentation. Okay. Basically, when the flood hit many areas in Selangor State on the 18th of December 2021, on Saturday, all the routes were stuck with a massive traffic jam as the water level kept rising due to the non-stop heavy rain since Friday, 17th December. Actually, as you can guess, when we are facing this 17th December is close to the Christmas and also to the end of the year. So all of us are prepared to have a vacation and all that. You know, we never thought that the flood come in a very sudden. As you can see from the photo here, we received the news about one of our members being affected by the flood. As you can see, the car, the motorcycle, the house. This is in the house, and that's around the posh area. Okay, next one. On the 18th December, so we received a WhatsApp at 11 p.m. on the 17th. And we never stopped doing the WhatsApp throughout the night. Then we decided to tell all our staff, maybe about 10 areas that affected, to evacuate their homes to seek for shelters elsewhere, while those unaffected cooperated to help them. So luckily for Nettie, one of our staff, Nettie Dahlia, who's been working with us for more than 25 years, her house affected. So one of our staff, Nick Azmani, used our four-wheel drive to get her to, bring her to a safe place in that morning around 8 a.m. On Saturday morning. Okay. Juliana, next
Yes.
one. Then around noon, a few other staff also pick up other staff and bring to the hotel that near to the section 7 in Shah Alam, which is quite safe. And just to inform everybody, at that time, sudden, all the places for shelter is full. And we also have to find all the hotel around the area also full. And luckily we find any boutique hotel or anything just to put our staff there. So things become quite panic for certain people. Then around 5 p.m., we still got a call from our staff, Mr. Nordin and family, who don't have a way to come up from his house. As you can see, this is their house. So at last, two of our librarians, Fazli from Selangor Public Library, Mr. Raja Tun Uda, and also Azhan we ran a four-wheel drive because we have only one Toyota. Then we ran from other people and pick up our staff family to bring to the hotel or to the library. And just to share one of the video that's sent by Nick Azmani, maybe it takes about 1 minute, maybe Juliana already put this thing. As you can see, the water is almost 4 feet, you know, and this area is only, normally it took about 20 minutes to go to my house staff from the library. He's one of our maintenance guy, Ali. So, but it took about more than 2 hours from the library to go and fetch him with his family and to go back to the Shah Alam. So it's quite scary to see this video because it's almost, but that's how the situation is. And during that time, we feel that we cannot depend only on the police or any authorities, because things are beyond that. Everybody is in the don't know what to do. So whatever that we use, the facilities, then we use. And as you can see, after a certain time, thanks to God that they passed through the flood and roughly safe at the library that day. Okay, so this is around 5:15 p.m. At the same time, around 6 p.m., the library is open on that Saturday. We know it's flood, but we never thought it's going to be worse. So around 6 p.m., still about 40 users still stranded and stay at the library because all the roads was flooded around that area. So these are all the photo about in our library, Rajatul Uday Library. Juliana, okay. And during that Saturday, actually we have 15 staff that were working on that weekend, led by our accountant. Even though she's not a librarian, but since she's working in the library, so she volunteered to come during the weekend to lead the team on weekend. So that day we have about 15 staff, but on this particular event, only 3 library staff out of 15 who were on duty during the day stranded at the library because of the flood. The rest of the staff, the 12 staff, mostly male, leave when their house also affected. So they went back home maybe around 2 p.m. around that because the house affected by the flood. So left only 3 persons, which is Farah Fariha, Roslyn, and Hamidah, to take care of the library during that particular day on the 18th of December. This is the photo taken at 7:30 p.m. Okay. Juliana, next slide, please.
Already, Datin Paduka. Datin Paduka, this is already the next slide. And I take it that maybe Datin Paduka's coverage
okay.
is not good.
Okay, Nana. Thank you. Nana, do you hear
Yes.
me?
Yes, I can.
Okay, thank you. Okay, sorry. Okay, so the line is not that good here, but it's okay. We just go through. And around 8:30, during that time, we discussed through the phone and we tried to get the consent from our chief minister, who is also our chairman, Datuk Seri Amuddin Syari, that we decided to use the Rajatul Uday Library in Shah Alam, the headquarters of the library, as a temporary shelter for our special guests. It means the victim of the flood. So we posted the social media to inform the public. So around 8:30 p.m. we post this thing. Then after we post it, then we get a very, a lot of phone call and messages that people ask for help. Because during that time, somehow it's jammed. Nobody can go anywhere because everybody's stuck in the jam and they stay in the car for a few hours. So after we post this in our social media, then around 11 p.m. people start coming and call. And during that time, because our library is at, you have to walk maybe takes about 10 to 15 minutes. If you drive, only 5 minutes. So we even send our own van to go and fetch people at the junction near to the flood area. Then during that time, since we don't have any male staff, we asked from the staff from our cafe to help us to drive the van and make few trips to get people to go to the library. And we are so very grateful that our library operator, cafe operator, Mr. Helmi, agreed to continue the cafe service to provide foods for all the library guests. I mean, people who are affected by the flood. We have more than 400 guests that night. We even provided the library van to wait at the junction. And also, since all most of the our special guests that affected by the flood, they don't have nothing. They just have to come with a very wet attire, and we just give whatever towel or whatever that we have. Then they come to our cafe to have their dinner after they are stuck about a few hours in the car. And among the library guests were this newlywed bride. Her name is Siti Fairuz Hanom, and her groom is Muhammad Fazil, but we cannot show, we don't have his photo, who was stranded in the section 13 Shah Alam, just came to the library for shelter and stay overnight here. We even say that basically you are having like a honeymoon in the library for the first day of marriage. So this is Puan Siti Fairuz. Then around 12 p.m., this is the photo that my staff took. The library guests, more than 400 people resting at the library sofas at the leisure reading area. And as you can see, they can stay wherever they like, you know, wherever that make them comfortable. And this area we reserve only for the ladies on the left wing. And for the right wing, we reserve for all the men. This is around the children area that we reserve for the men. So imagine during this time, only 3 of my staff who handle the whole building. So they stay at the reception counter. So if anything, that people can go to them and ask. So then around 4:15 a.m., more people coming. We just walk from the area that they're stuck in. So with wet clothes outside the library main entrance. So they have to stay there about a few minutes before they enter the library because they are really wet that night. Okay. This Sunday morning, and around 5:30 a.m. for the Muslim, we have to pray. We call it Subuh. Then they don't have any other t-shirt or anything. So our staff give our guests any t-shirt and clothes available at the library. So some of the t-shirt that the staff bought for the souvenir, we give everything to them. So as you can see, part of the t-shirt is from Frankfurt. That last time we made a trip to Frankfurt. So both are using the Frankfurt t-shirt. So that's one thing. Actually, what we bought is meant for them. Okay, next one. And on the 19th December, on Sunday morning, around 6:45 a.m., we're really thankful to our nearby resident association, Sri Alam Kondo, who immediately prepare breakfast for all our guests that night. So this is it's a very sudden setup. And we just use whatever it is. It's donation from the resident, individual, or whatever from our cafe, we bring it. So that much easier for our guests. I'm pretty sure they are very hungry that time. So around 7:30 a.m., the library special guests were served with breakfast, packed food ordered from the cafe, and some donated by the NGOs and the individual. This is how the situation looks like on the 19th of December. And more around 9 a.m. in the morning, Sunday morning, more people began to come to Rajatun Uday Library as the water level kept rising in several areas nearby and outside section 13 of Shah Alam, as you can see. So for the first time in our operation since in this new building since 2011, that we opened the library for 24 hours. This is the first time. And around 9:30 a.m., new guests came in, and some of those who stayed overnight at the library earlier left after certain area is already cleared, the water level have go down, and the library began to receive new batch of donated goods. And as you can see on the right, our librarian, Puan Nur Almin, was sorting and folding the clothes that were donated from the special guests. As you can see, everybody want to give, but we have to organize it. so it's presentable to our special guests. Okay, and then internet connection is unstable. Juliana, okay, Juliana, do you hear me?
Yes, I can hear
Okay,
you.
just next slide, please.
Yes,
Okay,
it is already.
thank you. Then around 11 a.m., more people coming, and donation in kind was pouring in from individual and various resident association in Shah Alam. As you can see, all sort of things that come. And we just give it to everybody who come, and even they want to go back to their home, I'm pretty sure there's no food, nothing on the house. We give them all the, whatever people give, and we make sure it's all go out immediate and fast. Okay. And the next. Sorry about the line, Juliana, if I'm
Yes.
stuck. Okay. Okay, and on the 19th December, around 5 p.m. same day, delivery of supplies become more and more. So what we did, we delivered to a school in section 24 Shah Alam, which was one of the temporary flood relief center. So we want to make sure that whoever give the donation is not only stuck in our library, but we get our staff to deliver it to other places. Whoever call, then we just send. And this is our vice chairman of the library, one of member of parliament, YB Dr. Mazli Malik. He went and visit the relief center. Okay.
5 minutes
Flood relief
left.
center. Next one, Juliana.
Yes. The next
Can
one
you
is
hear
that
me? Okay. All right.
yes, we delivered food supplies to another flood relief center at Sungai Kandis, Klang.
Mhm.
And seen on the left side is also our librarian. And the right side photo is the flood relief center. Datin Paduka, can you hear me? It's already on this slide.
Yeah, that's right. Yeah. One thing, because I would like to just why I wrote the name of Nur Azhan as a librarian. So I just want to feel that as a librarian, you can do a lot of things. And when I heard the presentation from the previous three panelists, I feel so proud that how the library really add value to people's life, how library really help people to organize their life, earn a certain income, get the knowledge and all that. So I believe that the library and the librarian can make difference to people's life, inshallah. Okay, next, Juliana.
Yes, 20th December, Monday on 1:30 p.m.
Monday.
Yes.
Okay, my line is not good, so you continue so that we don't take
Yes.
the time.
Okay, on this day, since most of the family members who were affected, they couldn't get out of their areas, but when we managed to get them straight from the boat, we rescued them from that place to Raja Tun Uda Library. So seen here is our head of corporate, Zafrullah, and also Fazli, the librarian you saw earlier, also helping all the flood victims to come to the library.
Yeah, and Juliana, I just want to highlight, if you see the photo on the left side, Mr. Zafrullah, there's a kid is with barefoot, they don't have any slippers and all that. That's why one of the advertisement where we asked the social media team to ask donation for slippers or any shoes for them. And a simple thing. Okay, thank you. Continue, Juliana.
Yes, thank you, Dr. Paduka. And here we redistributed all the goods that we received at the library to other areas, which this one is in Padang Jawa. And here again is Zafrullah and Nur Azhan, the librarian. And the next one on Monday, 3 a.m. in the morning, the library staff fetched a family and 4 children from Taman Sri Muda. Taman Sri Muda is one of the badly affected area. So we rescued this family and the 4 children to come to the library to stay overnight. And the same night, our member of parliament, YB Nurul Izzah Anwar, also came, and she donated 200 units of COVID-19 self-test kits. And seen on her right was Mr. Zakaria, one of the library's special guests. And this is on in the morning, and the library received a family and 4 children, and we brought them to the 4th floor fall shelter. And we still continued taking calls on 4 o'clock in the morning, especially from Taman Sri Muda, the badly affected area. And on the 4th day, on 21st December, our Vice Chairman, Dr. Mazli Malik, And Rajan Sri Asha Rajan Uda, the chairman of Rajan Uda Library Foundation, made a courtesy visit to the library guests here. Since we have Wi-Fi at the library, the guests who happen to be students, they can continue studying online. And here on Tuesday, this is one of the resting spaces for the guest. And the next
Nana,
one,
I'll continue.
yes,
Since
the next
I
one
do-
is the donation at.
No, okay, you. Okay, Nana, since Azan, yeah, I'll continue. Okay, at your place. Okay, thank you, Juliana. So on the 21st December, this is part of the sample that we put the social media, the poster, request for donation in kind. So we tell them what actually the special guests need, like blanket, towel, face mask, phone cables, charger, and all that, baby milk formula, and then even a dry food or anything. So it's really amazing how within this 2 weeks, almost 20 days that they stay, we have a very, I mean, I say that's a very good experience, how people really want to help. And what happened in, as Juliana, can you show the first photo about the mattress on the floor? Can you show that? Did you hear me, Juliana? Okay.
Yes,
Oh,
it's already
photo.
on this slide.
Okay, as you can see that, no, not for the, it's on the, this one, okay. At first, so many people give us a mattress like this, or even a toto, we call it. So lie down on the floor. So what happened one day, on the 21st itself, I saw one family, conceived of old people. They're facing problem to go up because of they're facing problem with the knee and all that. So when they have to lie down on the floor, it makes difficult for them. So that's why we discuss with few members, family and all that, who can donate in kind. So that's why on the 22nd of December on Wednesday, with the two, we asked for donation. Then they sent us 14 beds from IKEA. They bought it from IKEA with all the mattress and the bed sheet, everything complete with the pillows. So all our staff will install it immediately. Then we finish it around 10 p.m. to 11 p.m. So this is part of the room that we put it for our special guests, where we was given this type of room to the senior citizen, families, and the sick. These beds were donated to the guests when they return home. In fact, for this particular room, as you can see, it's meant for 2 people. There's a young couple who are facing problem with the kids having high fever. So since part of our library in the bigger room, there is a centralized aircon. So we cannot close the aircon just only for one family. That's why we decided to take a small seminar room, activity room. We convert, we bring out the table and we put the bed, and we go and have this table lamp and make them like they are staying in their own room. Because at this time, we can feel they are so sad with the almost total loss from the house. So hopefully by giving them, they can control the aircon. It's just a small room. So within 2 days, the baby become better, and they sleep without the aircon just for their family. So this is what we call it, how we can add value to people's life during this flood season. Okay, next, Nana. Thank you.
That's time, Ms. Dura.
Okay.
Can we
Okay, all right.
wrap up in a
Just
minute
the
or
last
so?
one?
Thank you.
Yeah, sure, no problem. Okay, so this all the donation that we receive. Okay, then Nana, next one.
Yes.
Any
Shall we
more
go
photo,
to
Nana?
the conclusion, Datin Paduka?
Okay. Yes. Last one, I have to mention this about about the stand that given by NATMA. So it makes so much difference, and we have this Red Crescent to check on their whoever are sick as our library guests. And the conclusion of this thing, just follow. I have to mention about this one, the activity that is done by the MBBY, Malaysian Book for Young Association. They do the storytelling, and also from Malaysian Library Association, bouquet donation, and everybody played their part for this particular event during the flood, when we turned library become the shelter place. Okay, so the conclusion from this thing, this is when all the houses that affected that stay with us. So we have sent a team to get them to clean up the house. And this part of the program, we touch on the spiritual. We believe that everything happened is with the will of from God. Okay, and the last one, the conclusion, Juliana.
Yes.
We have breakfast on the first day. So the conclusion is that the Raja Tun Uda Library became the shelter starting 18 December to 2021 to 6 January for 20 days. The library staff were on duty for 24 hours based on the working shift. And this experience made us to be more grateful and always remember that everything comes from God. And we should use our position to help more people and make difference to their life. And this experience gave us new energy to move forward, to appreciate everything that we have now. Even though it's end of the year, but we feel so good, even though we don't have the vacation during end of the year. And as just to share one of our strategy from year 2008-2019, when we do the rebranding, our aim is that to make library as our second home. Then after 2019, when we faced the pandemic in 2020, then we said that after I read one of the books from the Prime Minister of UAE, Abdul Rashid Al Khattum, the Prime Minister, he said that the government officer, their job is to make people happy. The government have to make people happy. That inspired us. So that's why we use the tagline, we copy paste it. We continue by having the library as my second home. The second step, library bring happiness. So this strategy, I just want to share here, it's not meant only for the people, but actually meant for our team in Selangor Public Library or Raja Tun Uda Library, Shah Alam, just to tell our staff to feel proud working in the library. Why? Because library bring happiness. How to bring happiness? People needs money. People need happy family. How are you going to get a lot of money or you get a job? Is having the intellectual knowledge and skill. And how to get a happy family is to have the spiritual knowledge. The question is that how to get this knowledge. So this is what I want to tell to our team, our staff. To get the intellectual knowledge and the spiritual knowledge, you have to get it from the education system. That is how our ecosystem of education works. So start with nurseries at young age from our parents, nurseries, kindergarten, primary school, secondary school, colleges, university, and libraries, museum, and archive. So everybody play their part. So we are at the libraries. We are part of the government institution to help people to feel happy because they got a job from the knowledge that they gained, and they got a happy family because they got the spiritual element in their life and they believe in whatever God asked us to do. We just follow and we have a happy family, inshallah. So basically, this is what we are doing, and we feel grateful that God gave us the opportunity to do during this flood session, so we can apply what we planned before this, and hope this thing also part of the SDG under the UNESCO. We have 17 SDGs, so hopefully they will make all of us strive to work for the people. And I would like to say thank you to all the presenters before this, and this is all our members. So many people help us during this flood as library at the shelter. So that's all I want to share today, and thank you very much for the time, and sorry for taking a bit extra time. Thank you. Thank you, Juliana. Thank you, Renita.
Welcome. Thank you.
Thank you. Thank you, Datin Paduka. Thank you, Juliana. Okay. Yeah, I think it's wonderful, really, how the library, the Raja Tun Uda Library offered a very safe haven to citizens, who were stranded. Everyone, we have now opened the Q&A segment in the webinar. So if you have any questions that you would like to address to our speakers, you can pop it into the Q&A chat box. I just want to say, after hearing all the 4 presentations, right, I think it's just wonderful. You know how everyone is really doing such amazing work to care and to provide health services to your own communities, you know, knowing really what every community needs in different countries, understanding the ground, because I'm sure the needs are very different, right? What is happening in Japan, in Malaysia, in New Zealand, in Australia. So maybe I would just then go on and ask the first question to our speakers would be, maybe you could share some of the challenges that you face in supporting your community's health and well-being. Anyone could take that question to just kickstart the discussion.
Okay, maybe I started. To me, the most challenging from my own personal experience is that to build the team that have the same wavelength, the same mission, and for us to complement each other in doing this. I believe that because when we say public library, normally among the government, it's a public library. It's different from academic library where people come by force because they need to pass the exam. So they will go to the library. But public library is something different. So we who are working with the public library or any library, we have to get people to come to the library by choice. So we have to be passionate enough. We have to have a very clear intention and all that. But we cannot do it alone. We have to do it in a team. So not only like ourselves, not only Selangor Public Library, but we have to get all state library in Malaysia. Then with the IFLA platform, we can have all the library. So from my first experience when I went to IFLA in 2013 in Singapore, then after that I went to Cape Town, it really opened my eyes and I'm really thankful for that. So I think the most challenging is to get the team to buy in the idea and work really hard and with a very clear intention. That's all. Thank you.
Thank you, Datin Paduka.
Thank you, Rita. Yeah.
Is Yoshimi, are you raising your hand?
Hi, I'm Yoshimi Matsuo. I answer the question, but in Japanese. 3つ課題があると考えています。効果的な広報、来館が難しい人への情報提供、従来の図書館サービスのリデザインの3つです。
Oh, I'm Shunsaku Tamura, and I'll translate her Japanese, but allow me to speak in broken English. You know, and she said that we recognize 3 challenges. The first is the need for effective marketing. That's essential. And the second is to reach out to those who have the difficulty in accessing our services and programs. So, for example, elderly people and expectant or new mothers, you know, and patients in hospitals and various types of handicapped people. And the third is the redesign of the present library services and programs. That's okay. Thank you.
Thank you. Thank you, Yoshimi. Okay, there's a question from the audience. It's thanks for the excellent presentation. They want to know how many library staff support health information. Maybe Jenny, Deborah, maybe I'll get each one to share how many staff that you have.
There we go. So I would say that across Victoria, which is our entire state, and that's our 270 branch libraries, we have about 3,000 library staff. And most of those library staff would spend at least some of their working time working on the library floor with the library patrons and customers, and would be involved in helping people to access information. Now, they're not all health library specialists. In fact, very few of them are, but most of them would at some point in their work on the floor be helping people with health-related inquiries. Jenny, do you want to add to that? Or not?
Yeah, I would only, I'll just add that some libraries may have special collections, but a bit like the Japan libraries, depending on what the needs are of their local community. So they might be on various topics. A lot of our libraries have parenting collections for like the New Zealand library. So yeah, there are various ways we provide information, as well as providing online services through our catalogues and things that people can access 24/7. Thank you.
Thank you. Laura? How about the Rotorua Library?
Again, probably similar to the other panelists, most of our staff at some part of their day will work with the community. And although, again, they're not specialists, they know where to find the information, they know the databases, they know the programs. We run a very collaborative library where although we have specialists, everybody sort of mucks in and does a bit of everything. So yeah, all our staff will be involved in helping with health literacy and knowing where to find information and how to help our community.
Thank you. There is a question for the team, for the speakers from Japan, to share your findings for the dementia program. And how is the program working and helping the beneficiaries? Sunsako, Yoshimi.
Do you mean sharing experiences with neighborhood libraries, or in the Tottori Prefecture Library? Which do you mean?
Yeah, I think it's based on the dementia program. Yes, your own library, yeah. The dementia program that you shared earlier.
この中で。この図書館。
館内での職員の研修会を開いたりして、お互いに共有するようにしています。
We regularly hold staff training programs. どのぐらいの間隔？
研修自体は毎月ありますけど、テーマはいろいろ。
We have training programs every month, but the theme of the training changes. So once in a while, you know. Okay.
Do you find that the program that you run, you do see that the dementia patients that they appreciate it, that those with dementia they can follow, or you see there's some improvement in terms of the recognition when they do the activities?
とても喜んでもらっています。
Yes, they are all pleased, and the popularity of the service spread word by mouth.
当事者の方も家族の方からも喜ばれていると思います。
The dementia people as well as the family members are all pleased.
Thank you. That means I believe it shows that what you're doing does work. Thank you. Thank you very much. Okay, everyone. With that, we have come to the end of the webinar. A big thank you once again to all our speakers for their insightful sharing of initiatives they've implemented or in the process of implementing. I'm sure they have given us lots of ideas that are useful for us to consider as we continue to refine and develop our own services at our libraries and workplaces. Thank you so much, everyone, for joining us today, and I wish you a good day ahead.
Thank you very much, Renita and everybody. Thank you.
Thank you, Renita and everyone.
Hey, thank you. Thank you so much for coming on board to do this
Thank
with
you.
us. Totally
Thank you,
appreciate
Kate,
it.
for managing
Thank
the Zoom.
you.
Yeah.
Goodbye.